Magnesium, uses, side effects and more. Magnesium's role in bone structure. Magnesium is crucial for normal bone structure and is derived from diet. Supplements may be needed if magnesium levels are low. Low magnesium levels can lead to diseases like osteoporosis, high blood pressure, clogged arteries, hereditary heart disease, diabetes and stroke. Magnesium sources. High-fiber foods like legumes, whole grains, vegetables, seeds, nuts, dairy products, meats, chocolate and coffee are good magnesium sources. Hard water with high mineral content is also a magnesium source. Magnesium function. Magnesium is required for bone growth and maintenance, nerve and muscle function, and stomach acid neutralization. It helps move stools through the intestine. Uses and effectiveness. Effective for bowel preparation, constipation, indigestion, seizures, and low magnesium levels. Prevents preeclampsia, a pregnancy complication marked by high blood pressure and protein in the urine. Likely effective for cerebral palsy, seizures, irregular heartbeat and arrhythmias. Effective for asthma, colon and rectal cancer and diabetes. Magnesium supplements and their use. Type 2 diabetes and magnesium levels. Magnesium supplements may be most beneficial for people with type 2 diabetes and low magnesium levels. Magnesium improves insulin sensitivity and reduces blood sugar levels in people who develop diabetes during pregnancy. High cholesterol. Magnesium chloride and oxide decrease LDL and total cholesterol levels and slightly increase HDL cholesterol levels in people with high cholesterol. Magnesium may lower blood fats called triglycerides in people with high triglyceride levels. Metabolic syndrome. Low magnesium levels are 6-7 times more likely to have metabolic syndrome than people with normal magnesium levels. Higher magnesium intake from diet and supplements is linked with a lower risk of developing metabolic syndrome in healthy adults. Osteoporosis. Magnesium by mouth prevents bone loss in older females with osteoporosis. Post-surgery pain. Magnesium increases the time before pain develops and decreases the need to use pain relievers after surgery. Premenstrual syndrome, PMS. Magnesium by mouth relieves symptoms of PMS, including mood changes and bloating. Vasospastic angina. Magnesium prevents blood vessel spasms in chest pain caused by spasms in the artery that supplies blood to the heart. Ineffectiveness of magnesium. Magnesium citrate by mouth doesn't reduce the risk of altitude sickness. Magnesium doesn't increase energy or endurance during athletic activity. Magnesium doesn't prevent nerve damage caused by cancer drug treatment. Magnesium doesn't improve limb pain after an injury. Magnesium doesn't reduce delirium after surgery. Magnesium oxide doesn't reduce hot flashes. Magnesium doesn't decrease the frequency or intensity of muscle cramps. Magnesium sulfate doesn't benefit children with sickle cell disease. Magnesium supplements during pregnancy don't decrease the risk of stillbirth. Magnesium use in treatments. Magnesium treatment does not improve outcomes or reduce death risk in traumatic brain injuries. It's unclear if magnesium by mouth is beneficial in concussion patients. Insufficient evidence for magnesium's use in alcohol use disorder, ADHD, back pain, bipolar disorder, nerve pain in cancer patients, immune system damage from cancer drug treatment, cardiac arrest, heart disease, chronic fatigue syndrome, COPD, cluster headaches, heart disease, depression, confusion and agitation after surgery, and muscle soreness from exercise. Magnesium supplementation may not reduce the risk of cardiac arrest, heart disease, CFS, COPD, cluster headaches, heart disease, depression, confusion and agitation after surgery, and muscle soreness from exercise. Magnesium's impact on health. Fibromyalgia. Daily magnesium citrate intake for 8 weeks may improve symptoms of fibromyalgia. Increased magnesium intake may lower the risk of fractures. Consumption of magnesium may not lower the risk of stomach cancer. Magnesium may prevent or improve hearing loss in people exposed to loud noise. Heart disease. Magnesium may reduce insomnia in the elderly, but not in those without insomnia. Premature infants may have a lower risk of brain bleeds if their mothers receive magnesium by IV. Magnesium may prevent kidney stones in people who have had kidney stones. Magnesium may lower the risk of liver cancer. Migraine. Magnesium may help prevent migraines, but not all research agrees. Magnesium may relieve migraines in those who don't get enough magnesium in their diet. Heart attack. Magnesium does not generally reduce the risk of death after a heart attack. Brain damage in infants. Intravenously administered magnesium may improve outcomes in infants with brain damage caused by lack of oxygen. Obesity. Magnesium may not improve weight loss in obese people. Death from any cause. Consuming more magnesium in the diet is linked to a lower risk of death. Pain chronic. Magnesium may lower the risk of chronic pain. Physical performance. Magnesium may help elderly females walk further. Polycystic ovarian syndrome, PCOS. Magnesium does not seem to reduce insulin resistance in PCOS. Pregnancy. Magnesium may reduce leg cramps during pregnancy. Preterm birth. Intravenously administered magnesium may prevent contractions during premature labor. Magnesium's use in medical conditions. Magnesium may delay labor by 48 hours, but its benefits are not universally accepted. It may reduce mineral buildup in pseudoxanthoma elasticum (PXE) and restless leg syndrome (RLS). Increased magnesium intake linked to reduced risk of death from stroke and improved mental ability post-stroke. Intravenous magnesium may protect the brain but not reduce death or disability risk. Mixed evidence on magnesium's effect in managing brain bleeding. It may reduce risk of death and vegetative state in some cases. Other conditions like allergic rhinitis, hay fever, and urinary incontinence require further research. Side effects of magnesium are generally safe when taken by mouth, but excessive amounts can cause serious side effects. When given as a shot or by IV, it is generally safe when used correctly by a healthcare provider. Magnesium safety and interactions. Pregnancy and breastfeeding. Magnesium is safe for pregnant or breastfeeding women when taken by mouth in doses less than 350 mg daily. High doses or prescription-only magnesium can cause diarrhea and bone and brain problems in infants. Children. Magnesium is safe for most children when taken appropriately or when the prescription-only injectable product is used correctly. Magnesium is safe when taken by mouth in doses less than 65 mg for children 1 to 3 years, 110 mg for children 4 to 8 years, and 350 mg for children older than 8 years. Magnesium is likely unsafe when taken by mouth in higher doses. Alcoholism and bleeding disorders. Magnesium may increase the risk of bleeding or bruising in people with bleeding disorders. Diabetes increases the risk for magnesium deficiency. High doses of magnesium should not be given to people with heart block. Magnesium given intravenously may worsen weakness and cause breathing difficulties in people with myasthenia gravis. Kidney problems can cause magnesium buildup to dangerous levels. Interactions. Major interaction: do not take magnesium oxide with levodopa-carbidopa, Sinemet, as it might decrease the effectiveness of levodopa-carbidopa. Moderate interaction: be cautious with magnesium and certain antibiotics that can affect the muscles. Antibiotics: take magnesium at least 2 hours before or 4 to 6 hours after magnesium supplements. Bisphosphonates: take magnesium along with bisphosphates to avoid decreased effectiveness.